Itchy skin after 60 can be frustrating enough when you can see a rash, but when there is no rash, it can feel even more confusing. You look at your arms, your legs, your back, your shoulders, and the skin may look almost normal, no obvious bumps, no clear redness, no visible reason, but the itching is still there. And that is when many people start asking, is this just dry skin? Is this part of getting older? Or is my body trying to tell me something? The honest answer is, it can be simple, but it should not always be dismissed. Itchy skin with no rash is often related to dryness, especially after 60. Older skin can lose moisture more easily and become more sensitive to dry air, hot showers, harsh soaps, and indoor heating, but if the itch is new, widespread, persistent, severe, or keeping you awake at night, it deserves attention, not because it always means something serious. It does not, but because itching with no obvious rash can sometimes be linked to more than the skin itself. It may be related to dryness or irritation. It may be connected to medications or supplements. It may sometimes be related to diabetes, kidney disease, liver or bile flow problems, thyroid disease, anemia, nerve-related itch, or another condition that needs medical review. The goal is not to panic. The goal is to notice the pattern before you spend weeks scratching, guessing, and trying random products that may not address the real cause. Many older adults assume itching is just part of aging, and in one sense, that belief is understandable. Skin does change with age. It may become thinner, drier, and less able to hold moisture. Something that never bothered you before, like a strong soap or a hot shower, may suddenly leave your skin feeling tight and itchy. So yes, dry skin is one of the most common explanations, but common does not mean certain, and aging should not become a reason to ignore a symptom that is spreading, worsening, or disrupting your life. Itchy skin is often called pruritus. It can happen in one area, or it can affect much of the body. Sometimes the skin looks dry or cracked. Sometimes it becomes red only after you scratch it. And sometimes it looks almost normal at first. That can create a frustrating cycle. The skin itches, so you scratch. For a few seconds, scratching feels like relief, but then the skin barrier becomes more irritated. The nerves in the skin become more sensitive. The area can itch again, sometimes even more. Over time, repeated scratching can lead to thickened skin, scabs, bleeding, or infection. So even when the original trigger is mild dryness, the scratching cycle can make the problem harder to calm down. Dryness is the first place to look. Older skin often does not hold moisture as well as it once did. Long hot showers can strip away natural oils. Strong soaps and fragrance products can irritate the skin. Dry winter air, indoor heat, and air conditioning can pull moisture from the skin. The itch may be worse at night, after bathing, or during dry weather. It may show up mostly on the legs, arms, back, or sides of the body. The skin may not look dramatic. It may simply feel tight, rough, or uncomfortable. But dryness is not the only possibility. Irritants are another common trigger. A new laundry detergent, a perfumed lotion, wool clothing, alcohol-based products, strong household cleaners, a new soap, even washing too often. After 60, the skin barrier may be less forgiving. Products that once seemed harmless may suddenly become irritating. That does not mean your body is weak. It means your skin may need gentler treatment than it did years ago. Medication timing is also important. Many people over 60 take more than one medication. Some medicines can contribute to dry skin, fluid changes, sensitivity reactions, or itching. Supplements and over-the-counter products can also play a role. This does not mean you should stop a medication because you feel itchy. Never stop or change prescribed medicine without medical guidance. But if the itch started soon after a new medication, a dose change, an antibiotic, a supplement, or a new over-the-counter product, write it down. Then ask your doctor or pharmacist whether it could be contributing. That timing can be a useful clue. Blood sugar is another area worth considering. Diabetes can sometimes be linked with dry skin, yeast infections, or circulation problems. When circulation is involved, itching may be more noticeable in the lower legs, This does not mean itching proves diabetes, but if you already have diabetes, prediabetes, or blood sugar concerns, and you notice persistent itching, slow healing skin, frequent infections, unusual thirst, or frequent urination, it is worth bringing up with your healthcare provider. Kidney disease can also be associated with persistent itching in some people. In chronic kidney disease, itching can be intense and difficult to ignore. The reasons may involve dry skin, minerals in the blood, inflammation, or nerve-related changes. Again, itching alone does not diagnose kidney disease, but unexplained widespread itching, especially in someone with known kidney problems, swelling, fatigue, changes in urination, or shortness of breath, deserves medical review. Liver and bile flow problems can also sometimes cause itching without a clear rash. This is one reason widespread itch should not always be treated as a simple skin issue. If itching comes with yellowing of the skin or eyes, dark urine, pale stools, abdominal swelling, or unexplained fatigue, that should be discussed with a healthcare professional promptly. Thyroid disease and anemia can also be possible contributors. They are not the first things most people think about when their skin itches, but they are examples of why persistent itching without a rash sometimes needs a broader look. Sometimes the skin is where you feel the symptom, but the cause may involve another system in the body. There is also something called nerve-related itch. In this case, the sensation may come from nerve signaling rather than a visible skin problem. It may feel like crawling, tingling, burning, or an itch that is hard to satisfy. This is another reason not to keep guessing for months when there is no clear rash and no improvement. One common myth is that if there is no rash, there is no real problem. That is not true. Itching can happen even when the skin looks normal. Another myth is that itchy skin after 60 is always dry skin. Dry skin is common, but it is not the only possible explanation. And another myth is that scratching is harmless. Scratching may feel helpful for a moment, but repeated scratching can injure the skin and make the itch-scratch cycle worse. So what should you pay attention to? Start with location. Is the itch in one small area? Is it mostly on the lower legs? Is it on the back, arms, shoulders, or scalp? Or does it feel like it is all over the body? Then look at timing. Is it worse at night? Worse after a hot shower? Worse after using a certain soap, lotion, or detergent? Worse after starting a medication or supplement? Worse when the air is dry? Next, look at duration. A few days of mild itching after changing detergent is different from widespread itching that lasts for weeks. And pay attention to sleep. If itching regularly wakes you up, keeps you from resting, or affects daily life, it is worth discussing with a healthcare provider. Also notice symptoms beyond the skin. Unexplained weight loss, fever, night sweats, strong fatigue, yellowing of the skin or eyes, dark urine, pale stools, swelling, shortness of breath, reduced urination, excessive thirst, frequent urination, slow healing skin, or signs of infection after scratching are all reasons to seek medical advice. You do not need to memorize every possible cause. A simpler question is this: is the itch mild, local, and clearly linked to dryness or irritation, or is it new, widespread, persistent, severe, unexplained, or affecting sleep? That question helps you decide whether gentle self-care is enough, or whether it is time to be checked. There are safe habits that can protect the skin while you are watching the pattern. Use gentle, fragrance-free cleansers when possible. Avoid very hot showers and long baths. Moisturize regularly, especially after bathing. Try to keep indoor from getting too dry. Wear soft, breathable fabrics. Avoid scratching when you can, and keep nails short to reduce skin injury. Notice triggers like hot water, soaps, detergents, wool, dry air, stress, medications, supplements, or new foods. And keep a simple itch diary. Write down where the itch happens, when it gets worse, how long it lasts, what products you used, whether it affects sleep, whether scratching changes the skin, and whether any medication or supplement changed around the same time. This may sound simple, but it can make a medical visit much more useful. Also be careful with over-the-counter creams, natural remedies, detox products, And supplement blends. Natural does not always mean safe. A supplement can still interact with medication. A cream can still irritate sensitive skin. And a product that temporarily soothes itching may not address the reason it started. If the itch is persistent or unexplained, covering it again and again is not the same as understanding it. So when should you talk to a doctor? If itching lasts more than a couple of weeks and does not improve with gentle skincare, it is worth making an appointment. If it is severe, sudden, widespread, unexplained, or interfering with sleep or daily life, talk to a healthcare provider. If it comes with weight loss, fever, night sweats, yellowing of the skin or eyes, dark urine, swelling, shortness of breath, reduced urination, excessive thirst, frequent urination, slow healing skin, or signs of infection, seek medical care promptly. And if it began after starting or changing a medication or supplement, do not stop anything on your own. Ask your doctor or pharmacist to review it. The main lesson is simple. Itchy skin after 60 with no rash is often related to dry skin, but not always. It may be dryness. It may be irritation. It may be medication related. It may be connected to blood sugar, kidney function, liver or thyroid problems, anemia, nerve signaling, or another issue that needs evaluation. Do not diagnose yourself from an itch, but do not dismiss a persistent itch just because you cannot see a rash after 60. Your body often speaks through patterns before it speaks loudly, and an itch that is new, widespread, severe, persistent, unexplained, or keeping you awake at night is a pattern worth listening to. If you want more calm, practical explanations about health after 60 and the body signals worth noticing, subscribe and keep learning with us.